Hi, you're watching Take 5 and I'm Aditi Prasad. From today, about 3,000 policemen are out on the streets in Nagpur to enforce a week-long lockdown after a 60% jump in coronavirus cases in the city. Only essential services such as vegetable and fruit shops and milk booths are going to be allowed to remain open. Nagpur, in fact, is the first Indian city to go back into this sort of a wholesale lockdown since restrictions were lifted in June last year. But recently, many other cities in Maharashtra, including Jalgaon, Aurangabad, Pune, Nasik, all have been put under partial lockdowns and night curfews due to the virus surge in the state of Maharashtra. Point is that as India witnesses a steady rise in the number of new infections over the past few weeks, there are clear fears of more such lockdowns being enforced in other hotspots across the country. Somebody asked me the other day, how bad is the recent rise in cases? Now, don't we have a vaccine now? Why is it being called a second wave? Well, because it well might be a second wave, I said. Daily cases crossed the 26,000 mark on Sunday. This is the first time since December 19th or in the last 85 days that this mark has been crossed. In fact, in the past week, India has registered the highest spike in the number of fresh cases since mid-December. Concerns over the start of a new wave of COVID-19 infections are therefore very much valid. And this spike is despite 1.26 million doses of vaccines administered on an average every day in the last week. In fact, India's inoculation drive is now the world's second largest in terms of daily doses being administered and is now behind only the United States, which is administering 2.5 million doses a day. The question is, why are cases rising again? Multiple factors, of course, are at play here. There's no one simple answer to this. But the main reason probably starts with our own COVID appropriate behaviors. Some spike in cases was actually expected once lockdown 1.0 was lifted and travel restrictions were lifted. But with pandemic fatigue weighing heavily on our minds and vaccine cheer adding to that melee, many people have started becoming careless or simply overconfident. They are not maintaining social distancing, not wearing masks, overcrowding at family functions, parties. I've been privy to a few of these people. I've seen them at work and at various other places. In other words, we as a country are slipping up on COVID appropriate behavior. Remember, COVID has not gone away. The virus is still around and it is looking for opportunities to spread. Secondly, a vast number of India's population is still susceptible to the infection. They do not have antibodies. Thirdly, it is also possible that there will be emergence of variants which could be more infectious as the virus mutates over a period of time. Remember, variants from South Africa, UK and Brazil have been identified so far. Let's talk about a little cheerful news. The good news is, or the hopeful news is, that the surges in cases is limited to certain hotspots and not the entire country. The centre has red flagged states such as Maharashtra, Madhya Pradesh, Gujarat, Punjab, urging them to enhance efforts to contain the spread. Health authorities have also warned Delhi and neighbouring areas of Noida, Faridabad and Ghaziabad to stay cautious. Now, measures that we had adopted in the beginning to curb the spread of the virus, like localized containment, stringent measures in hotspots, could be used effectively once again to control the spread. We must also immediately increase vaccination coverage for priority groups in the most affected districts. The other silver lining is that even though cases are rising, the case fatality ratio has been declining. For instance, in Maharashtra, the fatality rate in the last month has been less than 1%. There is clearly worry over the rise in the number of cases, but at least the number of people dying because of it or as a result of it is lesser. What more can the government do? Another hard lockdown, as some are predicting, is not the solution, especially given its social and economic downsides, which eventually can turn out lead to bigger problems than the virus itself. Sure, we needed a hard lockdown the first time around to prepare to deal with this crisis. It gave us time to upgrade our health infrastructure, our laboratories, procure ample ventilators, spread awareness. But now that these systems are in place, a lockdown can only delay the spread of the virus and not contain it. Many experts believe that authorities should open up the inoculation drive and make the vaccine available to everyone instead of limiting it. As on date, only people above 60 years of age or those above 45 years with comorbidities are allowed to get vaccinated. These experts argue that the age restriction is slowing down the pace of vaccination due to the low turnout. Now, the opportunity, they say, can be used to inoculate the larger population. India must also, on priority, approve more COVID-19 vaccines apart from the current two that are approved, which is Covishield and Covaxin, so that more vaccines are available and more numbers can be made available for vaccination and inoculation of the Janta as large. And finally, there is also an urgent need to involve the private sector in the country's last mile vaccine delivery efforts to accelerate inoculations. Now, if the government acts with speed, these measures combined will blunt this second wave of infections before it turns into a tsunami.